Good morning, everyone.
Morning.
Good afternoon.
Hello, everyone. It's Leo here. We're just waiting for one more panelist before we start our webinar. So let's give ourselves maybe a few minutes, maybe 5 minutes. Thank you. All right. Hello, everyone. I'm Leo. I'm the Communications and Project Officer at Youth Leads. And welcome to the commemorative webinar of the International Day of the Girl Child. So before we start, I think we can maybe wait just a few more minutes before we start officially. Thank you for your patience. Okay. I think we can all start now. So again, hello everyone and welcome to the commemorative webinar of the International Day of the Girl Child. This webinar is entitled Breaking Taboos and Raising Awareness. This webinar is jointly organized by Youth Lead, YPeer Asia Pacific, and AIDS Healthcare Foundation's Girls Act program in the Asia Pacific. And we are here to talk about and promote menstrual health and hygiene for adolescent girls, young women, and adolescent young key population. Before we start, I would just like to remind everyone of some house rules. Number one, for those participants who are not speakers or panelists, please keep your microphone muted at all times to ensure that we can have a smooth webinar and panel discussion. If you have any questions or comments, please feel free to use the chat box. We will monitor the chat box and get back to your questions at the Q&A session after the panel. Number two, this is a safe space for all adolescents and young key populations in all their diversity. And we take an intersectional approach to this webinar, so please let us all be respectful to each other with regard to our age, diverse sexualities, and gender orientation and background. Lastly, for your informed consent, this webinar is being recorded or will be recorded for documentation and communication purposes. It is also being live streamed on YouthLead's YouTube page, and which is linked on our Facebook page. If you are uncomfortable showing your face, please feel free to turn off your camera. So I will start the recording now for everyone's information. Now, without further ado, I would like to begin this webinar by calling on our esteemed guests to do our opening remarks, starting with Ika Novianti, the Regional Coordinator of YouthLeads. Ika, over to you.
Thank you, Leo. Hi, everyone. Good afternoon. As Leo mentioned, my name is Ika. I'm the Regional Coordinator of YouthLead. First of all, I would like to thank AIDS Health Foundation for the support on doing this important webinar. And I'm truly honored to be here with all of you. And I would like to extend my gratitude to our esteemed panelists, participants, and also everyone who has joined us today to engage in this critical conversation. Our objective for this webinar are clearly and deeply important. First, we aim to create a safe and open space for dialogue on menstrual health, particularly for adolescent girls, young women, and adolescent and young key population. This is a safe space where your voice, experiences, and also perspective are not only welcome, but essential to moving this conversation forward. Second, we seek to raise awareness about the challenges that many young people face regarding menstrual health, especially those in rural areas and in crisis situation. For far too long, these barriers have remained overlooked, and it is our responsibility to bring them to the forefront and work together towards meaningful solution. Lastly, we want to emphasize the importance of youth leadership and engagement in addressing mental health issues. The voice of young people must be at the center of any effort improving menstrual health outcomes. So your leadership, advocacy, and lived experience will drive the change needed to ensure that menstrual health is prioritized and supported across all communities. So I look forward to productive and insightful session today, and I encourage each of you to participate, share, and learn from one another as we collectively work toward a future when menstrual health is recognized as a fundamental right for all young people. Thank you. Back to you, Leo.
Thank you, Ika, for those wonderful opening remarks. Now I would like to introduce Dr. Chim Sara, the Asia Bureau Chief of the AIDS Healthcare Foundation, for their opening remarks. Dr. Chim, over to you. Dr. Chim, if you're there, the floor is yours.
Yeah, sorry, okay, thank you. Okay, hello everyone, and first of all, I would like to thank YouthLead and all for having me here today. I'm delighted to have the opportunity to talk with you all about the real problem of girls and women. Today's theme for this webinar is Breaking Taboo and Raising Awareness, a webinar of menstrual health. The issue is very relevant also to commemorate International Day of Girl Child and contribute from our level to make this world a safe and joyful place with dignity for girls and women. The webinar today will create a safe space for dialogue and raising awareness on menstrual health and hygiene, especially the barrier that adolescent girls and young women and a young key population face in the rural area and during the crisis situation. The AIDS Healthcare Foundation is a global non-profit organization providing cutting-edge medicine and advocacy since 1987. AIDS healthcare for more than 2 million people living with HIV in 46 countries. We are currently the largest provider of HIV/AIDS medical care in the world. We operate in 9 countries in Asia-Pacific region that include Cambodia, China, Indonesia, Laos, Myanmar, Nepal, Philippines, Thailand, and Vietnam. Under the leadership of President and the co-founder Michael Weinstein, AHF has grown from a group of friends dedicated to creating dignified hospice care to the largest AIDS organization in the world. President Michael Weinstein has been at the forefront of creating cutting-edge healthcare and advocacy programs and continue to drive the organization forward with the aim of saving more lives around the world. Girl Act is an initiative by AIDS Healthcare Foundation that aims to empower girls and young women to stay healthy, and through the initiative focus on helping girls stay in school, reduce unplanned pregnancy, and prevent HIV and STI infection. It is our pleasure to cooperate with Youth Lead to raise awareness and advocate for the right of girls and women, especially who underprivileged, stigmatized, and marginalized. It is my pleasure to share that we have Girl Act program in all countries in Asia Bureau region. AHF operates in Asia Pacific region, initiated multiple Girl Act issues to empower them through country-specific situation. Some examples include Cambodia, Laos, Myanmar, comprehensive sexual education. Thailand, China, Indonesia, girl supporting to improve adherence. Philippines, supporting for formulate teenage pregnancy bill. Nepal and Vietnam, empowering girls for their education and living. These girls are already struggling financially due to the situation they were born into, and other multiple issues and hardship set back their life. Without education, this day life is very difficult because they can't get a good job without qualification. It is a struggle as the cycle of poverty repeats itself once again. The girls are also at the high risk of experiencing health problems such as anemia, malnutrition, suffering from STI including HIV, birth delivery complication, and mental health issues for the long term. We should also include counseling about fear and concern, helping teens understand and what services are available in private and confidential manner, and what services require parental and guardian consent. Also important to note is the insignificance of HIV as a health of or life concern of the girl at the risk as they continue to have unsafe sex. There is a need to raise HIV awareness as it related to early and unsafe sexual practice that lead to early pregnancy. There are ways we can work together to develop a girl capacity to acquire and use skill and social competency to learn very important step to reducing the risk that they might experience. It is up to us to give youth the message that they are worthwhile, that they are adults willing to help themselves navigate the passage from child to adult. This message can come from family member, teacher, healthcare provider, as well as peer educator. AHF work on menstrual health is also part of its larger mission to provide cutting-edge medicine and advocacy regardless of ability to pay. As a campaign, AHF utilized Menstrual Health Day in 2021 on May 28 as a launch pad for its initiative to support women and girls in need and help them in school. The necessity, not a luxury, campaign kicked off to contribute 5 million free sanitary pads globally. Finally, I'm a father of 2 teenage girls. I love them and I want them to live healthy and happily. I'm very proud of AHF, as AHF has always been at the forefront of effort to support girls through bold and innovative projects. The work of Youth Lead also looks amazing. Let us ignite further our advocacy, elevate the level of discussion on sexual and reproductive health issues. We also invite everyone here join us to continue conversation and advocacy on improving the law and condition facing young girl and mother in all countries in Asia Pacific region. Thank you very much.
Thank you very much, Dr. Chim Sarah from AHF, for those opening remarks. Now, to give us a quick overview of facts on menstrual health and hygiene in the Asia-Pacific region, I would like to call upon Mr. Kim, the Regional Testing and HIV and Prevention Manager from AHF, to give us those opening remarks. Mr. Kim, over to you.
Thank you so much, Leo. Good afternoon, everyone, and delegation from the different country and member participant. Allow me to share my presentation.
I think you can share your presentation. Okay.
Okay, everyone, you can see that. Is everyone able to see my presentation? Just
Yes,
checking.
we can see the PowerPoint. Yeah.
Okay, thank you so much. Before I start, I would like to express my thanks again to Youth Lead and YPAP as well as HF who is able to organize this webinar. I will do my presentation here with the following outline. You can see here. I will just do a quick moment to really bring everyone here to see what is AHF and what is our mission and core value, and how and where are we implementing in the Asia, and what is really the menstrual health myths and misconception in Asia Pacific. Finally, we will also give you a quick overview what is really our intervention in the Asia region. Okay, AHF here is a global, based in global headquarters is the Los Angeles based NGO, and we are providing the cutting edge medicine and advocacy regardless of ability to pay. Currently, we are really the largest NGO who providing HIV medicine care in the world. As Dr. Sarat mentioned, we are really the largest one in the world. We operate in 46 countries and 9 in Asia bureau. Currently, we serve our client to more than 2 million around the world. Our mission here is to provide cutting-edge medicine and advocacy regardless of ability to pay. And we are value to our patient center, employee value, respecting to diversity, nimble as well as fight for what is right. And this is something really that we focus on our young and youths right here at the last one. So what are we doing in Asia here? For HIV, we are trying to promoting the HIV awareness and condom among at-risk population, high-risk youth. Yeah. And we providing advocacy for policy change, especially on guideline, policy, treatment, or advocacy that related to relevant to the different country that we support. We also expand the cost effectiveness model by trying to share what is really the success implementation model from the different country that we support to other country that we also support to scaling up the success model or expand the cost effectiveness model. We also promote the young girl right and leadership and empower them through our Girl Act program, which I will also explain you later on what are we doing with this Girl Act program. And also we support to elevate the nutritional status for our client and adherent as well as stay in care and retention in care through our Food for Health program. Next one, I also would like to bring you a quick fact, the menstrual health facts, myths, and misconceptions in the different countries in Asia. As you know, 1.8 billion girl, women, and transgender non-binary people of reproductive age, they have monthly menstrual occurrence. This is really the natural fact of life for our women. And 1 over 5 of young men aged between 20 to 24 years were married as a children. Nearly 1 out of 4 parents married adolescent girl have experienced sexual and physical abuse. 75 of new HIV infection among adolescents occur in girls globally. 1 out of 3 adolescent girls suffer from anemia, which lead to malnutrition. Yeah, and this is really the core fundamental for the human and development, which we need to require sufficient nutritional development. 1 out of 4 adolescent girls compared to boys are not in any form of education, employment, and training. And countries with highest completion rate of basic education have greater gain in reducing new infection among new HIV infection among young women and adolescent and girls. Specifically in our west part of Nepal, there is also in a traditional area where what we call Chupadi tradition in Nepal. This is a practice where menstruation girls are really considered impure and they are required to isolate to living in a small hut or it's away from their home and their family. And they are also not allowed, for example, prohibited to touching a family member or food or water sources. In some rural tradition community in China, menstrual is also still considered as impure and young girls may face many restrictions as well as religious activity, daily take, and also discussion in their daily menstruation activity, information, menstrual health. In the Philippines, some girls are not supposed to leave home and avoid certain foods. In rural area of Indonesia, menstruation is still surrounded by various taboo, restriction, and also suspicion. It is combined also with religious teaching, tradition, belief, and folk customs such as not allowed to pray, for example, enter to the mosque, or touching the Quran. Some are not allowed to have a pineapple, for example, food don't eat pineapple, not allowed to eat pineapple, soda or coconut water or ice. or eggs or peanut bean or sprout or sweet or sour or spicy food, which is really one of the food belief or restriction in such a community. Particularly in Cambodia, some girls cannot eat certain things such as fish or sour fruit. Some families do not allow their girl to touch book or to go to school, which also can stop them from schooling, as well as they cannot play with their friend and their community. In the rural community in Vietnam, menstruation is often surrounded by various taboo, religious restriction, and also social stigma. More than half of the community in Tan Xuan in Nha An province, like the Tho community, which consider as menstruation is to be culturally taboo, that was not openly discussed and also not accepted as a natural or normal part of life. In rural community in Laos and Thailand as well, menstruation is often surrounded by various taboo, stigma, and similar to those in Vietnam. In Myanmar, menstruation is also often surrounded by various taboo, stigma, and misconception. For example, in San State, menstruation girls cannot wash their hair or eat sour food when they have their period. Their fear is that if you do this, your menstrual will cramp and will be getting worse or pain, and your period will stop, or you get less period, or you fall sick. And these are really the misconception or belief from the different countries. And what are we doing, the menstrual intervention, what are we doing in by AHF in our Asia context? We initiate multiple girl issue actually to support to empower them through country-specific situation and intervention. For example, in HF implementing program, we have 36 countries globally and 9 countries in Asia by empower girl and young women to stay unhealthy and thrive. For Girl Act foster leadership and confidence for girl and young women aged 10 to 24 to support each other and strengthening fundamental life skills, develop community activism, and stay healthy. Primarily, the program supporting girl and young women to prevent HIV, STI transmission, stay on treatment, retention, adherence, and reduce unplanned pregnancy and stay in school. As you can see here, Food for Health also some part of our program as well as the girl app to give more education to young girls and to have a client elevate their nutrition and keep them on retention. Particularly in Cambodia, what we are doing right now in Cambodia, Laos, and Myanmar, as also I think this is repeated with Dr. Sarat, Chum Sarat, the Asia Bureau Chief, he already mentioned in his remark. I will not read again. The Cambodian, Laos, and Thailand, China, Indonesia, the Philippines, and Nepal and Vietnam, we are implement the menstrual health program following the need based on the country context. Like the comprehensive sex education is different, is implemented in particular country, Cambodia, Laos, Myanmar, and Thailand, China, and Indonesia is supporting to improve retention and adherence for our girls who stay in the center. Same for Philippines, they are more advocate for the teen pregnancy bill, and Nepal and Vietnam, they also empower their girls through education and income generation. Beside all this partnership, beside all this working with the different countries, HF in Asia, we also working in close collaboration with our partners such as Youth Lead, as today example that we also joining together to do this webinar to elevate and to improve a more understanding on the information related to the girl. We also working in close collaboration with Global South Coalition for Dignified Menstruation of the Radha Podel Foundation in Nepal to also raise awareness and advocate for the girls of rights and women, especially who underprivileged stigma and marginalized group. AHF and its Girl Act program donate over 2,400 period underwear for our 3 program in Asia. This is including Cambodia, Philippines, and Indonesia during our menstrual health day in May 2024. This also lead to girl miss school with reported 20% of young women and girls missing school due to the period. Another innovation project we implement for our AHF China team that they install sanitary pad dispenser in school, clinic, so that those who menstruate have access to this product for free. In Cambodia, we also help with social media training for girls, contribute to the pad and also period underwear to more than 500 students in the school. China also organized creative event with sanitary pad, embroidery, and also to promote menstrual health awareness and ending stigma activity in the school. Particularly for our Indonesia country, we also combine education session with cultural performance to engage 150 students. In India, we also open house to discuss and cultural program led by our local children, emphasizes on menstrual hygiene and education. Particularly in Laos, the collaboration with also health organization to raise awareness about menstrual health and HIV prevention. In Myanmar, we also provide educational talk, distribute sanitary pad, nearly 200 clients in the clinic who visiting the clinic. In Nepal, diverse activity, including webinar, flash mob, and also a policy dialogue to promote dignified menstruation activity is being carried out in the past year. For the Philippines, we also focus on community education through the talk discussion in school, workplaces, and while in Thailand, we are supporting young Myanmar migrant and with entertainment activity and free hygiene product. Finally, to end my presentation, I would like to express my feeling as a father with 2 daughters. In my family, not only father, but also a mother play a crucial role in supporting their daughter during menstruation period, as well as contributing to a more inclusive understanding in the family and society. And this is really what my wife and I are doing in my family to my girl openly in the family. We need to ensure that girls feel safe, respect, empowered during this natural phase of life by openly discuss menstruation in a supportive environment. This helps them to feel relaxed, less anxious, and also more confident for themselves. In the community, this topic can be broadly discussed in school with both male and female students to increase awareness and reduce stigma. Finally, I would like also to express my profound thanks to youth lead, YPAP for jointly organizing this webinar, and I also thank you to the HF family who also supporting, also joining this event. Special thanks to Dr. Chomsra, the Asia Bureau Chief, for joining and honoring to opening this remark. Thank you and Som Akun Chiraan.
Thank you so much, Mr. Kim. Yeah. Okay. Thank you. Thank you so much, Mr. Kim, for those overview of the facts on menstrual health and hygiene in the Asia Pacific region, and also an overview of the programs and interventions led by AHF regarding menstrual health and hygiene in the Asia Pacific region. Now, let's hear now from our young panelists, and I would like to start our panel discussion. First, to introduce our excellent panelists, I am joined here by a number of panelists, 4 panelists. First is Cinta Dewi, AHF Girls Act leader in Bali, Indonesia. Cinta is the leader of the AHF Girls Act Indonesia since 2023. She focuses on HIV and STI prevention, sexual reproductive health and rights among young women and young key populations. Another of our panelists is also Maria Iqbal Shah, a core member of the YPeer Asia Pacific, who is advocating for children's rights, menstrual hygiene, climate action, and mental well-being. Following Maria is also Raham Biasa Digrantara, a trans man who is a member of the Trans Men Indonesia, a community network working on trans men issues in the country. And lastly, we are joined by Sandeep Kumar Paul, the National Coordinator of White Peer Bangladesh, with a background in youth leadership, SRHR and climate advocacy, and community engagement. So welcome, everyone. I hope you are all well. I think, yes, we are putting you all on the screen now. So I hope you are all well. I see we have a diverse group of panelists here representing adolescent girls and young women, young trans men, and also young cis men to talk about menstrual health and hygiene for young women and girls, and also trans men. I think it's great that we also have young trans men and cis men representatives here, because we know that menstrual health is not just a women and girls issue, and we need to engage young trans and cis men as well to talk about this topic and demystify or break some taboos and misconceptions about menstrual health and hygiene, as we heard earlier. So to start the panel discussion, I would like to ask my first question. I would like to ask this first to Sinta from AHF. So Sinta, what are the key barriers on menstrual health for young women and girls in your country, in Indonesia? And if you also know anything about the barriers at the regional level in Asia Pacific.
Okay, thank you, Leo. Can you hear my voice?
Yes.
Okay. Okay, thank you for the time. First of all, I think we are all living in a world that is constantly changing. There are many new things that we will discover, both the problems and the solutions. And what I think is the most basic things that can answer problems are by increasing our knowledge through education. But at the same time, this has also become one of the key barriers on menstrual health and hygiene for the young people, not only for those who live in rural areas, because the lack of access to comprehensive education and correct information will lead us to the misunderstanding about menstruation. And also, I did a little research about menstrual health and hygiene. So I found that in 2015, UNICEF study revealed that 1 in 6 girls in Indonesia had no knowledge about menstruation prior to their first period. And I could say from my own experience, the lack of education or information about menstruation or even like menstrual health and hygiene made me scared and also confused. And also, in many cases, girls had not been taught how to properly use sanitary pads or even how to manage menstrual hygiene due to the stigma around discussing the topic openly. And we all know that girls who get their first menstruation will be around 15 or between 10 to 16, according to the research. And that means that they must have enough knowledge about menstrual health and menstrual hygiene management before that. And those who have the responsibility to guide and provide correct information for the girls are parents and especially their mothers, as Mr. Kim said before, and also teachers at schools. But I think menstruation topic is still not an important issue in the society, because when we wanted to talk about menstruation, they still think that the topic is such a taboo subject as we discussed today, right? And even parents and teachers sometimes they feel uncomfortable in discussing about menstruation, and it's also affect the girls to afraid talking about menstruation. And also in some cases, there are male that contributes in increasing the taboos. And this is definitely contributes to the widespread of myths and misunderstanding about menstruation. Also, without proper informations, Girls are less likely to understand how to take care of their bodies during menstruation, which also can lead us to health issues and lower self-esteem. And also in specific areas such like rural areas, they face significant barriers related to access, affordability, and acceptance of menstrual products. And all I could say is because in rural areas, they tend to have like a low income household. For example, in Papua, especially in the rural areas, they have very limited access to commercial menstrual products. Even if it can enter the area, the price must be increased. So this makes our sisters in Papua use like other alternatives such like clothes or even leaves or other material that are neither hygienic nor comfortable. And of course, we could see that there is a chance to infections. And also, when we talk about the adults and girls or young women, school plays a critical role in providing menstrual hygiene management support because girls spend most of their time at school or at university, but many schools in Indonesia still lack adequate facilities like proper toilets, water, sanitation, and even the hygiene. And this has also become my own concern as I see a lot of my friends faces difficulties to access the facilities. And I think when we are outside our house, it will be more like difficult for us to access the facilities. So it would be better if the government or the institutions can provide adequate facilities for us, like proper toilets that have clean water, sanitary disposal options, and also menstrual pads. It will help us a lot in our crucial time. And even in during the crisis situation, for example, in earthquake in Lombok in 2018, displaced women and girls have faced difficulties in increasing and in accessing menstrual hygiene product. They lived in temporary shelters with little access to clean water, private toilets, and even safe space for changing sanitary products. This even exposed the gaps in emergency preparedness for meeting menstrual health needs, especially for vulnerable groups such as adolescents, girls, and young key populations. And this should be the government concern. Moreover, the government already has a department that focuses on children and women, and they should be able to pay more attention of these issues. I think that's all, Leah. Thank you.
Thank you, Sinta, for that very comprehensive overview of like all the barriers and issues for women and girls in Indonesia. Now I want to move over to Maria. So I know you work at the regional level, and you also work on, mental health, SRHR, and climate advocacy. Could you give us an overview of any of the barriers, challenges, and priority issues at the regional level or also in your country? Over.
Thank you so much, Leo, for asking this question. So I'll start with the intersectionality part, like the climate change and menstrual hygiene and management. So here I just want to share a story from Pakistan. So in Pakistan, last year we had floods. And due to those floods, we had this, terminology invented, which was monsoon brides. Like young girls were married off and like they were sold off because their parents, their families can't cover their expenses, can't manage their menstrual hygiene and management supplies and stuff. So as you can see, like due to the climate change, due to the floods and natural disaster, it's very much badly affecting on the menstrual hygiene and management part. As already mentioned by Shinta also, that we also already have too much barriers, stigmas and taboos around MHM. So as we already have barrier, stigma and taboos, and in addition to that, we have climate change issue. So it's, you know, causing extra burden on females. So that's the one thing like about climate change part. Secondly, as you asked about the with respect to mental health, so as we know that menarche, most of the girls, most of the females don't know that like before menarche, they don't know about, you know, periods. So they should know about it. Like there should be, you know, education regarding period education. They should know about comprehensive sexuality education focusing on MHM. So as they don't have that education, so they don't know how to manage, you know, menstruation. And again, they don't know how to manage it. It's you know, creating traumatic experience for them. It's badly affecting on their mental health. Not only on their mental health, we have, you know, several terminologies in mental health also, like pre-symptomatic menstrual, you know, PMS, menstrual syndrome, and we have post-menstrual syndrome. So they are suffering from such kind of, you know, situation with regards to mental health. So that's second pointer. Thirdly, if I talk about with respect to Pakistan, so in Pakistan, we have a very much, you know, cultural and religious stigma around menstruation. So here, like Muslim population is very much high, and as already mentioned by Dr. Kim, I guess that people like can't like females can't read Quran, they can't touch Quran, so it's very much common. So due to menstruation, as menstruation is considered unclean in Pakistan due to religious and, you know, cultural taboos and stigmas, females can't perform their religious and cultural activities, ceremonies. And also what it is leading to, like as due to the cultural and religious stigmas, family the female can't, you know, sit along with their families and, you know, can't perform their, you know, family ceremonies and stuff. And as they don't sit with their families, it's resulting to, you know, GBV and bullying, because the male family are, you know, dominant in this particular situation, and they are resulting into gender-based violence and bully, you know, the females of the family. So that's the another thing, like which is in result of the religious and, you know, cultural stigma and taboos. Yeah. Also, yeah. So here I also want to emphasize on the WHO AAAQ model, which is accessibility, availability, acceptability, and quality. So with regards to menstrual hygiene and management, we are lacking on this particular model. Like in Pakistan or in South Asian countries, still there is no acceptance of using sanitary pads or menstrual cups or tampons. So there is a lack of, you know, acceptance in South Asian countries. Secondly, we don't have, you know, access to such supplies. So again, there is a barrier in accessibility. Availability, as I explained I explained situation of floods in Pakistan. So in Pakistan, due to the climate change and humanitarian crisis, what happened that we don't have such, you know, supplies. So availability was another barrier. And then quality. So I was reading one research and I found that, okay. So I was reading one of the research, and there I found that in Pakistan, the sanitary pads, like most common, you know, menstruation supply they use is the sanitary pad. And those sanitary pads, like some of them don't know how to, you know, manage, and they reuse those sanitary pads, due to which it's causing rashes, and it's again leading to urinary tract infections. So yeah, here again, quality is one of the, you know, problem with regards to menstrual hygiene and management. So I guess I covered all the problems with regards to Pakistan. Yeah, thank you.
Thank you, Maria. And it's great that you mentioned you know, how the stigma against menstrual health, against menstruation, is resulting in GBV, gender-based violence, and bullying, and also, you know, the repeat usage of sanitary pads. So I want to quickly jump over to Raham. You know, we have talked mostly about young women and girls so far, and we don't really know a lot about the menstrual health and hygiene issues for trans men. Could you tell us what are the challenges and key issues for trans men regarding this issue. Over to you, Rahan.
Okay. Can you hear me well?
Yes.
Okay. First of all, I would like to say thank you to Youth Lead for inviting me to be one of the panelists here. I'm excited to be here to talk about MHH. And I have actually prepared some notes of what and how I'm going to deliver MHH to you all. And also inviting you all to see MHH from a broadened and progressive perspective. So, when we talk about menstrual health and hygiene, uh, especially for young trans men, not only will we talk about menstrual health and hygiene itself, but also security and safety are a part of the conversation. So, why are security and safety should be included on MHH when it comes to young trans men? So, for a little context to understand this, Indonesia has many discriminatory laws against LGBTIQ plus that, of course, includes transgender people. Besides that, pathologization. So, pathologization is where transgender is seen as a disease or a sexual deviation, still lives among the society here. So, the discriminatory laws and how the society here still sees transgender people as a disease or a sexual deviation creates or build this binary um, perspective among the society that only women and men exist. If you're transgender or if you're outside men or women, then you are not normal. So this also creates tension and suspicion towards transgender people. For example, many young trans men can't even access public restroom for security and safety reasons. Because here in Indonesia, if we want to access public restrooms, maybe to change our pads, if someone sees us as having a masculine expression but still have a feminine posture maybe from our body, they would have this like weird suspicion that, oh, are you men, are you women, are you a boy, or are you girl? So that alone is a struggle for us young trans men. um, so because of that, transgender and restroom is when it's blowing up, this topic is automatically a hot topic here in Indonesia. So that's why a thing as simple as accessing public restroom, maybe to change pads, is a big challenge for us. Is we're talking about security and safety here. So many young trans men who experience menstruation had to spend their days feeling anxious and always on alert, especially when having to change pads on public restrooms. Why? Because as you know, when changing pads, like opening like sanitary pads, there's usually this specific sound they make. Like when you just open the pads, it sounds just like so specific to the point where when you hear it, you just kind of can tell that someone is currently changing pads. So having a masculine expression and entering men's restroom, changing pads, like we have to change our pads so silent and so slowly, anxiously, on alert, just to change pads. Which is ridiculous because changing pads is such an everyday life thing. It's a simple thing to do, but for us transgender men, we have to do it very cautiously, and that really, to me, that's messed up. That really affects my mental health. So um when people hears this, like, okay, how about menstrual cup? That's usually the response to this story. Okay, menstrual cup maybe for some trans men could be a useful option when it comes to menstruation tools. But other trans men, such as myself, find that menstrual cup is uncomfortable to use, that can cause gender dysphoria. So gender dysphoria is this unbearable, uncomfortable feeling between, myself and my gender identity with what I was assigned at birth, like that. So I feel like I'm disconnected with myself, with my identity, with my soul. So knowing that using a menstrual cup, causes gender dysphoria, uh, it has something to do with, like, I am aware that there is a thing inside my genitals, and that really makes me feel uncomfortable. So, of course, menstrual cup for some trans men can be an option that is a useful tools, but for me, for some other trans men, it can be an uncomfortable tools to use. So, other than discriminatory laws and pathologization that I mentioned earlier, that can put young trans men at risk in every aspect of our lives, including MHH. One of the key barriers is stigma. So you know how structural all of this are, like discriminatory laws, and then pathologization, how people sees us as a disease, and then that just creates a stigma for us. What are the stigma when it comes to like MHH and transgender men? You know how like they would always say this, like, men can't menstruate, or if you menstruate then you are not a man, you are a woman. And this statement, this stigma, doesn't only harm the trans men community, but also harms other communities within the LGBTIQ plus community. You know how trans women are also women. Does that mean if the stigma says if you menstruate then you're women? How about trans women? You know, like this doesn't. This stigma is so problematic and harmful to the point that it's bad for everyone within the LGBTIQ plus community. So it's harming because it can affect our well-being. It can affect how we search for or find information regarding menstruation, how we access MHH services, how we care about our sexual and reproductive health in general. So, you know, how menstruate can be such an uncomfortable and depressing even experience for trans men. And I think from this, one of the affirmation we can do to lessen the impact of this is to see MHH, menstrual health and hygiene, from a broadened perspective. How? We can begin by introducing the term assigned female at birth. Now, if we see menstrual health and hygiene from this perspective, from this scope, from assigned female at birth, it really invites us all to see that menstrual health and hygiene shows that diverse gender identities can also experience menstruation, not only women, but assigned female at birth or AFAB, you know. Um, and I think it's also important to include assigned female at birth to this conversation. That's why I said earlier, I am very thankful that Youth Lead invited me to this webinar because it's really time for us to see um, menstrual health and hygiene from a broadened and progressive perspective by beginning to using or introducing this term assigned female at birth. Maybe that's all from me.
Thank you, Raham. And that was a very great overview of, the experiences of trans men, especially young trans men when it comes to menstruation. Menstruation or menstrual health also affects their mental health. Your mental health. You mentioned, you feeling anxious just to changing pads, going to the public restroom, and menstruation itself causing gender dysphoria, and so on. So it's great that you can represent trans men and give us that perspective. Now, I'd like to move over to Sandeep. Sandeep, I know you also work on SRHR and climate advocacy in Bangladesh. Could you tell us the challenges and issues in Bangladesh, and also maybe from your perspective as a cisgender man? How can men and boys engage in this topic of menstrual health. Yeah, over to you. Hope you can answer that question.
Thanks, Leo. Good afternoon, everyone. First, I would like to begin by expressing my sincere gratitude to YPRC Center, your thoughtful webinar on menstrual health. It's truly an honor today to join on the International Day of the Girl Child to discuss an issue that affects millions of lives, but is often hidden behind stigma and silence. My name is Sandeep Kumar Paul, and through my years of work in rural and crisis-affected areas of Bangladesh, I have witnessed the daily struggles that girls and young women face in managing their menstrual health. I'm here not only to speak from data and statistics, we all see that over the internet, but also to share the real stories that reflect the resilience and strength of these young girls. Allow me to share the story of Rupa first, a 14-year-old from a remote, flood-prone village in Bangladesh. We all have seen from the news the recent crisis and flood situations in Bangladesh. So during this monsoon season, her village is often cut off from basic resources, and access to necessities becomes a challenge. For girls like Rupa, managing menstruation during this time turns into a distressing experience. Without access to sanitary products or even private facilities, Rupa faces anxiety, discomfort, and even shame, all because menstruation still remains a taboo topic in her community. In rural regions and during crisis situations, especially floods, young girls encounter several barriers in managing their menstrual health in Bangladesh. When the local shops in Rupa's village were flooded, sanitary products became inaccessible. Even when they were accessible here and there, they were far too costly for their families in the rural areas, forcing girls like Rupa to resort to unhygienic materials that put their health at risk. Many homes and shelters lack private clean toilets. During floods, especially, Rupa and her friends had to rely on communal latrines with little to no privacy at all, causing them to stay indoors due to the fear of humiliation. In rural areas of Bangladesh, menstruation is deeply stigmatized till date. Rupa once told me she believed that discussing her period along her with her peers, with her family, it would bring some kind of bad luck or something to them. An idea this is still instilled by the community's silence and shame around the topic. In our school, menstrual health should have been addressed, but it is rarely, if ever, addressed. Without proper information, girls like Rupa are left to they're left to navigate their health alone. Often they fall victim to the harmful myths and misconceptions around menstrual health. The combination of these barriers are also leading to psychological effects, including anxiety, lower self-esteem, and frequent absences from school. We see in the results how the girls are outperforming the boys in our country over the past few years, but actually in the remote areas, the widening gap between the boys and girls in accessing the educational resources is very concerning. About the trans and cis men, although this is a topic that is illegal in Bangladesh currently, so the community that we call them the third gender. They have their own kind of specific challenges regarding this topic, especially as they are very marginalized. Like people do not people some kind of address the problem regarding menstrual health of girls in developed areas, but the term we call them the hijra community in Bangladesh, the third gender community, which has legal recognition. So their menstrual health is very taboo. We are far from interacting with them. So in the situation where the young women and girls are not even getting the basic facilities in rural areas, in crisis situations, in isolated villages. The condition of third gender individuals regarding this matter is even more severe. We, along with some other organization, YPR Bangladesh, works with the marginalized communities, and some other organizations are working too. We are continuously advocating for their rights, taking workshops regarding these topics, and sitting on roundtable discussions with local level municipalities leaders about this topic. But the thing is that government, we are continuously advocating to the government to recognize these issues and integrate these concerns too. When we are talking about menstrual health, we are leaving these marginalized communities aside. This should not be the case. We are continuously working to incorporate their participation so that they too can represent and speak their concerns, speak the specific challenges they are actually facing. We are working on that. But I think, and I believe that more and more NGOs and organizations working on this cause will come forward, and the government will have a separate body that will address these concerns specifically. So that was the challenges and barriers I would have liked to mention from Bangladesh. Over to you, Leo. Thank you.
Thank you, Sandeep. And it's great to hear, what you mentioned about like the story about the young girl in Bangladesh. When it came to crisis situations or climate change, the lack of information and also the access to products, the costly menstrual products for them. And also great to hear you mention about the NGOs and the governments, which is a great segue to my next question to all of you. What do young people need from communities, NGOs, and governments to improve, menstrual health and hygiene for young people? Maybe I can ask Cinta to answer this question first. Like, what do young people need from communities and NGOs and governments?
Leah, thank you so much for the questions. So as young women, I think we have to what we need from the communities, NGOs, even governments are first access to menstrual product. As I mentioned before, that many adolescents, girls, and young women, especially those in rural areas, need access to the affordable menstrual products. Just like also I said before, that economic barriers often forcing them to use like unsanitary alternatives like clothes and leaves that I mentioned before. And it will be easier if government and NGOs can like implement a subsidy programs or even like distribute free menstrual product in schools, also like public spaces, or even through community programs. Just like us in Girls Act Indonesia, we actually will celebrate also International of the Girls Child tomorrow in Bali, and we have like a focus group discussion with all of the youth and also other youth organization, and also in that even we will also distribute like a menstrual pants for the girl, for the young women, for the girl, for the adolescent girls. And also for the second one is the comprehensive menstrual health education. We need to ensure that young people understand to manage their periods, not just the biology of the menstruation, just like what I get in school or other like we get in school, but also about the hygiene management and dispel myths and also the taboos. Also, communities, school, and NGOs can create like a supportive environments to talk about menstruation openly, and it can happen only if we normalize and continuously promoting about it in the public. And also for government, they should support us as a community who care about adolescents, girls, about young women, both in the program funding support and the needs. And we also need to continue on doing like campaigns to normalize menstruation and break the stigma. Also, it is very important for me to involving boys and men in the conversation about menstruation, to build a supportive environment for the girls. And also improve facilities. As I said earlier, we need adequate facilities in schools and in public spaces. Additionally, during the crisis situations, we also need like clean water, sanitation product, and hygiene facilities in shelters. And I hope that government and NGO can collaborate together, and also maybe communities and our organization can collaborate together to provide this. And last one, I think the integration of MHH education and public health programs and in schools also, we also need these things, because like as I said before, education is such an important thing for us, and government also needs to integrate this menstrual health and hygiene into public health policies and emergency framework response in order to provide accessible sanitary products. And I think we need to fight for the regulations requiring access to menstrual product and MHH education in schools. Thank you, Leo.
Thank you, Sinta. That was amazing and really comprehensive. Again, you mentioned not only the access to menstrual products, the affordability of those products, but also, the importance of comprehensive menstrual health education, or more broadly, comprehensive sexuality education to be integrated in schools. And you also mentioned, the supportive environment to talk about menstruation openly, and the importance of engaging men and boys to talk about menstruation as well. And it's also great to hear about you talk about the campaigns to normalize menstruation, as well as public policy and emergency framework response for menstrual health and hygiene. Now, I'd like to move on to Maria. Maria, what do you think young people need? Or what solutions, do young people need when it comes to menstrual health and hygiene? Over to you.
Thank you so much, Leo, for this question. So particularly for this question, I would like to relate with examples what YPR Asia Pacific is doing, and what youth want from us. So first of all, youth want a safe space where they can talk about menstrual hygiene. They can talk about their mental health, like what are the traumatic experience they are suffering from due to this, menstrual hygiene and management, due to the stigmas and taboos. So for that, we as YPR AP, we already have this Me for Myself International Mental Health campaign. So our campaign is providing safe space where we, try to have open conversation regarding such stigmatized and taboo topics. So that's the one thing that we as a youth need a safe space. Secondly, as already mentioned by Shita, regarding the comprehensive sexuality education. So yes, when we are talking about comprehensive sexuality education, we should be, focused on the menstrual hygiene, menstrual health. So there should be, a portion where we as a youth can, work on the case studies. We as a youth can have hands-on experience regarding the menstrual hygiene and health related, activities. So in YPR AP, we have these regional academies, we have e-courses, we have training of trainers, where we try to, train youth. We train youth and we try to normalize such stigmatized topics. Once we train those trainers go back to their countries, and in their countries, they try to, implement such projects. They try to make this conversation, open. Thirdly, with respect to, government, what government can do. So in Pakistan, we have this lady health worker program. So lady health worker program is like, obviously, it's a program for specifically for the women, where they are trying to, have conversation with women, and they are trying to, give them the supplies for their menstrual hygiene and management. So this program is initiated by the government, but we want from government that they should initiate more such programs for, trans male and trans, cis trans male both. So that's the thing which we want from government. And second, we want policies regarding normalizing this menstrual hygiene and SRHR related topics. So policies should be there, through which youth can work on such issues easily. Last but not least, I would like to emphasize on research and data collection. So while working, searching for these questions, I found that there is very much limited data with regards to Pakistan or with regards to South Asian countries. So there should be more and more data. There should be more and more, research regarding menstrual hygiene and management. So we can know that we can assess from youth's perspective that what they need. And accordingly, the policymakers and accordingly, NGOs can work. So yeah, that's it from my side. Thank you.
Thank you, Maria, and thank you for mentioning those interventions that you would like. And it's also great to hear about what YPR Asia Pacific is doing, especially the safe space for young people to talk about stigma and taboo topics such as menstrual health in the Me for Myself program. And also, you mentioned the importance of data collection, working on case studies, and also definitely training other young people to talk about taboo topics such as menstrual health, and for them to bring those trainings to their communities and start destigmatizing menstrual health to their communities, to young people in their communities. So Raham, same question to you, I guess. What do young people need, or what do trans men and trans people in general need from communities, NGOs, governments, and what kind of solutions do you think we can do to improve menstrual health and hygiene for trans men and women in general?
Okay, thank you for the question. I think for me, first is, of course, affirmation. Like I mentioned earlier, one of the things NGO or like the government or maybe us, the allies, all of us could do to help fulfill the needs of young transgender men or transgender in general is do affirmation, to see menstrual health and hygiene from a broadened and progressive perspective by beginning to introducing the term assigned female at birth or AFAB to be more inclusive and to include people who are assigned female at birth when it comes to producing information regarding menstrual health and hygiene, so that from there um, we could provide an inclusive information for the community. Besides affirmation, I think we could do more collaboration, like how Kak Shinta has, had tell us earlier that how she is actively engaging with women, girls on menstrual health and hygiene. I think in Indonesia, how there are a lot of NGOs with their own issues, their own focuses that works under the umbrella of the LGBTIQ plus issues, can collaborate, or maybe intersectional issues where usually NGOs who works in SRHR issues also works with people who focuses on LGBTIQ plus issues, So we could definitely totally maximize this opportunity to collaborate more, to know, to work together between these different issues and intersectional issues. So I hope that from many collaborations that we could do, we can educate more individuals and giving affirmations, like I mentioned earlier, to more young trans men or young transgender people in general out there regarding menstrual health and hygiene.
Thank you. Thank you, Raham, about that, the importance of affirmation, of, the needs of transgender people in general, especially transgender men in terms of menstrual health and hygiene. We do need to look at this issue, more broadly and also from a more progressive perspective and become more inclusive. You mentioned, it's important to use inclusive language, such as using assigned female at birth, because not all, women, for example, are assigned female at birth. There are trans women who are women who are assigned male at birth, right? And also great to hear about your mention about collaboration, because we do need, more collaboration across NGOs, but also with governments, and also donors to work on sexual and reproductive health and rights and menstrual health and also LGBTIQ issues, because these are all interrelated. So now to Sandeep, what kind of solutions or what do young people need from communities and NGOs and governments from your perspective? Over to you, Sandeep.
Sure, thank you. In Bangladesh, well, even though there are efforts underway to improve menstrual health management, these services, that's the problem. These services don't reach those in the most remote or crisis affected areas. The services are quite good in the capital and in major cities, but we need the most, the need is the most in the most remote and crisis affected areas. The government, although has begun distributing free sanitary pads in certain schools and is working to include menstrual health education in the curriculum. However, the implementation we have seen over the years is inconsistent, especially in the rural areas where the teachers themselves are not trained well enough on these topics. Well, several NGOs conduct awareness campaigns and distribute hygiene kits. During the recent floods, we have seen that some organizations have set up emergency response teams who deliver supplies to the isolated villages. And like I mentioned the story about Rupa, for girls like her, it has brought temporary relief. Also, health workers play a crucial role in spreading information and providing support. We have some popular doctors in Bangladesh who run their own YouTube channels to spread information on these topics. And I'm glad. I think more and more people of such expertise should come forward to spread this kind of information. But so far their reach is limited, leaving the remote areas and isolated areas during the crisis times underserved. And to truly address these challenges, we need more effort from communities, NGOs, and governments. I think subsidized or free sanitary products, particularly during crisis, would ensure that menstrual health isn't compromised. Because we see that during the crisis, there is many financial and physical barriers regarding this. Girls need safe private facilities in schools, shelters, and without proper infrastructure, managing menstruation becomes nearly impossible, especially in emergencies. Like from our organization, we have previously worked on installing these menstrual health kits in schools, and there are many other organizations taking such initiatives, and we are first providing them free sanitary napkins and everything. And over the time, we want this adaptive change so that the school communities come up and do this themselves once they get used to and see how these initiatives are impacting their students. I think menstrual health should be normalized in school curriculums and community discussions. That's one of the major points that we are keeping this in as a taboo still in so many areas of Bangladesh. When young girls, their parents and their teachers of schools, when they are informed enough, the stigma and shame surrounding this is naturally has the tendency to decrease. Uh, Menstrual health management should be incorporated to our disaster preparedness plans. When the government bodies plans these disaster preparedness strategies, they often leave this part aside. So this should not be overlooked. And emergency supplies and trained response teams should be ready to support the affected girls during the crisis times. So that's some suggestions from Bangladesh that I think would help bring this topic under the light from the dark clouds. Thank you. Over to you, Leo.
Thank you, Sandeep. And yeah, you mentioned, yes, the importance of, ensuring that sanitary products, menstrual health products need to reach hard to reach and crisis affected areas, and that they need to be subsidized or at least free for young women and girls and trans men, when they need to access these products. And also great to hear you mention, the importance of healthcare workers, how they play a crucial role in providing information and services, especially these influencer doctors and healthcare workers that you mentioned who have their own YouTube channels and who maybe have like TikTok as well. I know I see some healthcare workers talk about comprehensive sexuality education as well on Instagram and TikTok and YouTube. So yes, it's important to also engage those actors, those stakeholders in how we disseminate information and also maybe services to young people in our communities. So I think we have some time for a question and answer portion. We have like 3 minutes, so maybe we can answer maybe just one question for all of us. I'd like to focus on this one question from Kurniawan from AHF Indonesia. Is there any country or government that have considered or implemented policies allowing students to take time off during menstruation due to the discomfort or pain? So do you know, any of you have any information on those kinds of policies from different countries, or what kind of policies does your government have when it comes to menstrual health? Anyone want to take that question? No? Maybe other people, there are other panelists. Deepak, yes, please.
I think what I learned from the community is that community are becoming more sensitive, and they have started making available sanitary pads in the schools for targeting girls. And if really girls are poor, and there are a couple of NGO who are also providing free sanitary pads for the whole year. In that case, just because of period or menstruation, they don't need to leave the school. But we should, rather than having a holiday or the day off, we should offer them the treatment to deal with the pain and all other issues. In that case, maybe girl will not lag behind the boys, because one day missing in school will also hamper their educational performance. In that case, maybe like organization like Youth Lead should take the lead and guide us based on the country specific situation. Thank you.
Thank you, Deepak. Kim, you wanna come in?
Yeah, thank you, Leo. To the question, I think it's very interesting question from Kurniawan from Indonesia. I do a quick review as well for question. Yes, there is a country in Asia. For example, in Japan, there is a menstrual leave policy created in 1947. Known as Seri Kuka, this policy is allow women to take leave during the menstrual period if they experience severe pain. Yeah. In South Korea, it's introduced menstrual leave in 2001. Yeah. And yeah, I think that's really the country in Asia that introduced such a program. In Taiwan, I think the act of gender equality is allow women to take 3 days off menstrual leave per year, which are not deducted from their statutory sick leave. I think these are really some information from the Asian country. Yeah, thank you.
Thank you, Kim, Mr. Kim. Yes, it's interesting to hear about the existence of these policies, and I think, as Mr. Deepak mentioned earlier, it's important, that all our country contexts are different, and we will need to work at the country level to identify what are the best solutions or what are the best policies to deal with menstrual health and improve menstrual health and hygiene for young people in general, because there are many different solutions that we can look at. Yes, so I think this is it. This is the end of our webinar. We don't have any more time left. Thank you all so much for participating in this webinar commemorating the International Day of the Girl Child. I would like to thank our excellent panelists, our young people, young experts about menstrual health and hygiene for joining this panel, this webinar, and sharing their thoughts, their insights, and obviously expertise, because I've learned a lot about menstrual health, and I hope everyone has as well. So thank you very much on behalf of Youth Lead, YPR Asia Pacific, and also AHF. Thank you all for joining this webinar, and happy International Day of the Girl Child. Oh, before we leave, sorry, maybe we could have a group photo, if possible, or if anyone likes, just to commemorate this webinar before I forget. Wait. So okay. So if everyone is comfortable to have their photos taken, please open your camera. If not, it's okay as well. No pressure. But yes, we will have a photo. Okay. If everyone is okay, so 1, 2, 3. Another one. Okay, I guess not. Okay, another one. 1, 2, 3. Okay. Now, thank you, everyone. Thank you for participating once again in this commemorative webinar. Happy International Day of the Girl Child. Bye.
Bye.
Thank you.
Thank you.